much.
All right, recording has started, so let's start with Loma Linda.
So welcome to this Western region. I feel very privileged to be the first person to take off here. It's a pleasure to talk to you about the uniqueness of the Loma Linda program. I think the thing that makes the program unique is that it's a big program, 100 residents total in training, but feels a lot smaller. And I think that this comes from our heritage, which 116 years ago started with a mission just to educate. We didn't come in with a plan to have a huge campus like we currently have and all the research and all the tertiary and quaternary care. It was just educate and send physicians basically all over the world. We're a very global based campus. And so we've sent basically all the various different healthcare fields train on this campus and go all over the world through our Global Health Institute. It's one of the unique characteristics of the program, which we'll talk about in a few minutes. I'm going over the highlights, and I've mentioned here that we are quaternary care. That would include things like ECMO, currently a 55-bed PICU that's going to be expanding an additional 25 beds because we just moved into a brand new tower yesterday. 17 stories for adults and 9 stories for children, and we moved all the patients yesterday. So in the process of that move, we're going to be expanding our ICUs and step down. Currently, we have 350 beds, and we'll basically be staying at about 350 beds, but with a few more beds in the ICU. We have very few fellowships. We have fellowships in NICU, PICU, ER, child abuse, and then we have child neurology. That's also a part of our program. But a lot of the fellowships are not represented on the campus. So our residents literally work at a fellow level and do a lot of the consulting and working one-on-one with our programs, our subspecialties, that is. So a lot of autonomy in the program. We have about 55% that go Gen Peds, and as you can see, about 45% fellowship. I think that's going to push more to about 50-55% fellowship now that we have more hospitalists that are beginning to develop in the program. I've already talked about, we're within about an hour's drive of all kinds of various different demographics, everything from in the winter, you can snow ski within an hour. We're an hour from the beach. We're an hour from Disneyland. We're about an hour and a half from San Diego. So lots of things to do and a lot of camaraderie in the program with several different retreats during each year. Loma Linda is a unique environment. It's a faith-based environment, but there's no requirements whatsoever to be faith-based. And I don't think anybody ever feels uncomfortable here, no matter what their faith or religion might be. But one of the unique things is we happen to be a blue zone. And if you don't know what that is, I would encourage you to look it up. It's kind of fun. It's an area in the world where people tend to live to be centenarians. So there's a higher than normal population of 100-year-old people, which means that you're living in an environment that has a lot of walking and exercising and health-based dieting and various different things that are very unique specifically to this program and to our hospital. I've already mentioned in the curriculum the global health. We have a huge global health institute that's been a part of us for 116 years. We have a very unique outpatient clinic that happens to be an FQHC, federally qualified health center, which speaks to the poverty of the population. We are very strong in advocacy. We have a block month of advocacy as well as options for electives and research electives as well. As far as diversity, we have a very diverse, the last class was the most diverse class I've matched, 40% self-declared underrepresented minorities in medicine. And we continue to have a very, very diverse city and county that we live in with about 65% Hispanic population and about 15% Black population with a little less than 1% American Indian population. So quite a few reservations in the area. You can read the details online and the location is obvious. So I think that pretty much covers it. Is that my 5 minutes?
You have 2 minutes left.
Oh my. So I guess I could talk a little bit more about diversity. We did start something called DIME, D-I-M-E. That stands for Diversify, Include, Mentor, and Educate. And that task force in the department has been tasked with coming up with ways to analyze and survey the entire department, including residents and faculty, regarding implicit biases and various different levels of understanding societal oppressions. We've also worked on getting them to help us with retention and recruitment of various different underrepresented. And we've been quite successful in the last few years with hiring anywhere from 3 to 4 underrepresented faculty per year. I think we can stop there and let the next person go.
All right, thank you guys so much. Sorry, guys, 1 second. So next up, we got Valley Children's. Valley Children's, whenever you're ready. I'll let you guys know when you have 2 minutes left.
Thank you, Chip. Hello, everyone. My name is Vinny Vijayan, and I'm the program director of the Valley Children's Pediatric Residency Program located in Madera, California. And I can't tell you how excited I am to see so many people interested in peds. This is incredible. So about our hospital, we are a 330-bedded children's hospital in a very affordable part of California. So we are 160 miles away from the Bay Area and then around 200 miles away from Los Angeles, right in the middle. So because of our location, our catchment area is huge. We take care of 1.3 million children over 13 counties, and we are the only hospital in this area that takes care of children exclusively. So what does that mean for you? It means that when you come here, you have the opportunity to take care of a diverse array of patients, from bread and butter pediatrics to complex patients. The population that we serve, similar to what Dr. Reisen said, is that they are medically underserved. So the work that we do is not only incredibly important, but also just really, really, really rewarding. So about our program, we have 13 residents per class. Last year, nearly half of our class went to primary care, and then around a quarter went to hospitalist medicine and a quarter went into fellowship. Over the past couple of years, we've had fellows go into programs across the country. We've had fellows in CHOP, Yale, UC Davis, Michigan, CHLA, all over. In terms of our curriculum, our residents can rotate in a number of different clinical sites, but I think what's nice about our program is they have 6 different continuity clinic sites that they can choose. So you can tell your experience based on what you're looking for. So for example, if you want to go into ICU and you would want to take care of technologically dependent children, like G-tubes, trachs, you can go to Charlie Mitchell Clinic. If you want to be in rural medicine, you can go to our Fowler Clinic. If you want to be in an FQHC program, you can go to Camarina. So it's whatever you want to do. Similarly, we have 2 resident tracks, academic medicine and leadership, primary care and advocacy to choose from, and you can move between tracks if you would like. In terms of community pediatrics, this rotation is designed to introduce residents to different areas of Fresno and Madera. We have residents go on our mobile health van and do immunizations, fluoride treatments, provide care for a lot of children in our rural community. I think what is a little different in our program is that we do have a structured SIM program. So our interns and our residents have time scheduled in their academic half day to attend the SIM lab, so they can focus on areas that they feel that they need help in. I think another aspect of our program that may be a little different is that we have a research coordinator that is dedicated to helping our residents with research and quality improvement projects. So it helps them through that whole process, from submitting an IRB to getting your abstracts and posters presented at national meetings. And then in terms of diversity initiatives, as you all know, the San Joaquin Valley is home to greater than 70 different ethnicities and more than 105 languages. So our resident class is similarly diverse. We have around 26% of our residents are Hispanic. We have 6% that are Black or Middle Eastern, around 36 that are Asian. So as you can imagine, these residents are really involved in a variety of initiatives regarding DE&I. They have a resident diversity council that holds mentorship programs for a number of high school students. They go out to the community and do projects, teach them about how to get into medicine through a number of mentorship programs. And then we have curriculums based on LGBTQ related issues, healthcare disparities, and ACEs. And then lastly, I just wanted to mention resident wellness. So residency is a very, very, very rigorous 3 years. Our program has a number of initiatives that are built in to encourage resident wellness and prevent burnout. That includes, wellness weeks, birthday parties, retreats. We have a wellness fund that may be used by the residents to purchase things that encourage wellness, like, camping equipment, hiking equipment, season tickets to games, painting supplies, whatever brings you joy. That's what we want you to use those funds for. How many minutes, Chip, do I have? Am I out of time?
You have 1:30 left.
Okay, all right. That's all I actually had to say. But if you have any questions, feel free to contact us. Our social media, our links should be there. And I really just want to thank you all for sharing your evening with us. And then I wish you all the best in finding the best program that fits you.
Thank you so much. So up next, we've got Oregon Health and Science University. So whenever you guys are ready, and I'll let you know when you've got 2 minutes left.
Thanks so much, Chip. Hello, everyone. My name is Megan Ayler. I am the program director at OHSU, and I'm so glad to see all of these promising future pediatric residents. It's really exciting. As you will likely see over the next 20 minutes and over the recruitment season, there are so many similarities among programs. You are entering just the most amazing field. And so it's going to be hard for me to pare down program highlights and what I love best about our program in just a few minutes, but I will do my best. So we are a medium-sized program in Portland. We are a pretty busy tertiary care referral center that serves not only the community of Portland, but also a large catchment from Southwest Washington, as far down as the southern tip of Oregon and some parts of the northern portion of California, and really the entire state. So we have a solid Gen Peds base in our ambulatory and inpatient world, as well as really kind of tertiary and quaternary care that we provide. We find that our medium-sized program allows for really strong resident-faculty relationships and the ability to really meaningfully individualize our curriculum. I love that our program really builds a strong Gen Peds foundation with ample time in the ambulatory setting, with dedicated rotations as well in all of the core ACGME pediatric specialties. So we really see the value in resident spending dedicated time in the inpatient, outpatient, and consultative role for cardiology and endocrinology and pulmonology to create this depth and breadth of their Gen Peds foundation. We have pathways in primary care, subspecialty care, and acute care, hospital-based careers. And then again, our individualized curriculum time really is at the resident's discretion. All 6 of their blocks that they have for IC time are very free for them to develop their own learning goals and objectives. There's a lot of direction that's given to that, but also a lot of freedom and flexibility to tailor the curriculum to their needs. With respect to the culture, we have a culture that values equity, diversity, inclusion, and well-being. And we have a number of initiatives on campus that exist. We have longitudinal curriculum in health equities and anti-racism. We have an institutional respect for all policy. We are involved in pathway programs and are located in a vibrant city of Portland with beautiful mountains and ocean nearby. I do want to, just with respect to some of the diversity content, I want to also share some time with one of our fabulous adolescent medicine providers, Dr. Jessica Serrano. She directs our adolescent medicine rotation, is a leader in our education program, and also is directing our visiting student UIM program. So I'm going to just hand it over to Jess to say a quick word about the environment of equity, diversity, inclusion at OHSU and make a plug for our.
Hi, everyone. So as Dr. Ayler said, I'm Jessica Serrano, one of the adolescent specialists. And so one of the things that I find really exciting is actually the amount of diversity that we do encounter on a day-to-day. I just think, being very honest, when people think of Portland, they don't necessarily, like, diversity maybe doesn't necessarily come to mind, but we actually have quite a large migrant farm worker population, and a lot of jobs that attract individuals from different backgrounds, ethnic backgrounds as well. And so, for instance, like in our inpatient units, you definitely will have experiences to work with non-English speaking families, not necessarily just Spanish, but we do have plenty of experiences, for instance, where we have to use our in-person or video interpreters. But then also, as the adolescent director, we work a lot in the school-based health centers. And so that there is a great opportunity where you will work with a pretty diverse patient population from all sorts of socioeconomic backgrounds. And then really exciting thing this year is we launched our funded visiting student elective, which is designed for those students that are underrepresented in medicine. And so it includes a stipend that will be used to cover some of the travel, housing, application reimbursement. You are paired with a resident to provide some mentorship. You will have a meeting with the program director, Dr. Ayler, and then it also includes having an interview for a position in our pediatric residency program. So again, I think, there's a lot that we are working on to try to improve and just really showcase the diversity that may be, I would say, under-recognized in our region.
Thanks so much, Dr. Serrano. I think that brings us to time. There's so much more that we could talk about with respect to scholarship, advocacy, quality improvement, but I think it's time for us to hand it over to someone else. Congratulations, everybody, on joining the best field.
Thank you so much, guys. So up next, we've got Kaiser Permanente. So whenever you guys are ready, feel free to go.
All right, thank you. So great hearing about all the programs we have here in the Western region. I'm Nami Javeri. I'm the program director for Kaiser Permanente Northern California pediatric residency, and we are located in Oakland, California. So we are part of Kaiser Permanente, as most of you know, a very large health network here on the West Coast, but throughout the country and Hawaii as well. And our residents get to participate in our integrated healthcare system, which serves a very diverse patient population here in Oakland, and also allows our residents to have really great access to some of the strengths of Kaiser, their great community partnerships, their strength in preventive medicine, and also our really amazing division of research, which is based here out of Oakland. And alongside with that, we have a dedicated pediatric resident research coordinator that works with our residents to help develop their scholarly work. So we have all these great resources by being part of a large institution, but we also are a small program. So we are 10 residents per year, and we really have this very supportive family feel. And so I think we get, the feel of an academic program with the research. We have medical students from UCSF, but we also have a very community feel with a really nice camaraderie amongst our residents. We have a full breadth of pediatric specialties here at the Kaiser Oakland Medical Center. We are a referral center for all of the other Kaiser hospitals in many of the parts of the Bay Area and Northern California. And so our residents get to rotate with many different specialists, ranging from neurosurgery to allergy, and then also continue to have really great primary care experiences. One of the really unique aspects of our program is we do have our categorical track, which is 3 years of pediatric residency, but we also have a 4-year track, which is a joint pediatric residency MPH track. And so for anyone interested in doing an MPH during or right after residency, this is a really great opportunity. You get to do a 4th year at UC Berkeley, which is fully funded for the MPH, as well as you receive a 4th year salary. And then in terms of where our graduates go, it's pretty evenly split. About a third go into primary care pediatrics, About a third go into inpatient peds, including fellowship and PHM. And then a third go into other subspecialties and do fellowships. And we've had really successful matches in recent years. In 2021 and 2020, we had residents go to Columbia, Seattle Children's, Stanford, UCLA, OHSU. And so we've been really excited about having our program recognized at these different institutions. One of the things our curriculum has is a 3+1 innovative schedule. And so what that is where you do a rotation for 3 weeks, a cardiology award, followed by 1 week of continuity clinic. And this is a newer model, but a lot of programs are adopting this to allow really great continuity within your clinical site. Our residents also do PICU during their first year. And then we also have a longitudinal community health and advocacy rotation. So that means that rotation spans all 3 years. It's 2 half days during the clinic weeks where our residents participate in our REACH program, where they partner with community organizations or local schools to do healthcare advocacy and interventions for children. And then in terms of our diversity initiatives, our residents and our faculty are really passionate about our EID work. We have a resident-led EID community. We have a very robust Grand Round series with amazing speakers. And then we also have more intimate resident workshops that we've had recently on implicit bias, inclusive community building, and looking forward to doing one on structural racism. And so we continue to work towards pipeline development and really working to support our URM residents and surrounding communities. And then finally, in terms of location, we're in a vibrant urban community here in Oakland, one of the most diverse areas in the country. And so we're really lucky to work with such an amazing population. And when people think about Kaiser, they think about insured, but we do also take Medi-Cal and have a really diverse socioeconomic group of patients. We have great community partnerships through REACH, and then we have amazing food, arts, cultural scene, performances, and then really wonderful outdoor activities available to our residents. So if you're interested in our program, please check out our website or join us on Instagram or reach out to our chief residents. One of them, Shaughnessy Craver, is with us here today telling, I think, cheesy jokes in the chat. So thanks again, and I look forward to hopefully meeting some of you.
All right, thank you so much. Up next, we've got Children's Hospital Oakland. So whenever you guys are ready.
Hi, everyone. I'm Celeste Allen. I'm the program director for our program. Thanks again for having us, and also just excited to see all the future pediatricians. Thanks to NAMI for talking so much about Oakland. So our hospital is very close to Kaiser Oakland, and we have great partnerships with them. We are a unique hospital. We are the safety net hospital for our area. We are at about approximately 200 beds, the level 1 trauma center for the area, and we have an affiliation with UCSF. So kind of a unique combination of community health as well as a university affiliation. We have a lot of unique aspects as well. Other highlights are we're the only inpatient pediatric rehab facility in Northern California, a hematology center for excellence. Our residents have their continuity clinic in our FQHC, which is one of the only pediatric FQHCs in the country, and rotate through our school-based health centers on their adolescent rotation, so a lot of community exposure. Residents rotate all 3 years in the CAP rotation, which stands for Community Advocacy and Primary Care, where they get to do a lot of work in the community, build partnerships, see lots of resources for families. And that, I think, is a very popular rotation and exposure for our residents. We also have intentional early exposure to critical care. So our residents rotate kind of in all areas, emergency department, PICU, NICU in their first year to expose them and help them be prepared to be a senior resident. We have an emphasis on resident well-being. We have mentor families, which is a new development where we have a lot of support from all 3 levels of training. Our residents are very close-knit kind of family. Most of their rotations are at our hospital. So while we're at 82 resident program. Residents really get to know each other well and really get to know our faculty well. We also don't have a lot of fellows. We have fellows in our emergency department, PICU, HEMONC, infectious disease, as well as some visiting trainees who come through the hospital. But residents really get to work one-on-one with faculty on their elective individualized curriculum and get to know the subspecialists really well. We do a lot of teaching here. So we have third-year students, fourth-year students, a lot of visiting programs from all over the area come to do their pediatric experiences at our hospital, which I think is great for our residents because they get to teach as well as learn from their colleagues. As Nami said, Oakland is a really diverse place. It's one of the most diverse cities, and it is the most diverse city in California. The Bay Area is a really wonderful place to live. We have great weather in Oakland. In terms of additional curriculum, our residents have a cultural humility curriculum that's integrated throughout their 3 years and integrated into CASE conference as well. Cultural humility is a concept that was really developed at our hospital back during the Rodney King protests and has been very integral in the work that we do with patients. We have opportunities for research. We have SIM curriculum, lots of procedures as we have a very busy emergency department. We have a new ultrasound curriculum, Nexplanon training, other LARC training, QI rotation. And then related to diversity, we have really been doing a lot of work with diversity for so many years. It's really an integral part of our hospital. One of the things that I think all of us value is the diversity of the patients that we serve, as well as the staff and all of the ways in which we learn from each other. And we have a cultural humility outreach committee to work on integrating that more fully into the curriculum for residents. We have diversity days. We've been doing those for African American and Latinx applicants for over 10 years and recruiting them to our program. Nami talked a lot about Oakland, so I don't have to talk as much about where we are and what there is to do, but we're very central, so very easy to get to our hospital. Residents live often all over the Bay Area and often will maybe have a significant other or a partner who works elsewhere. And our hospital is very easy to get through either via different forms of public transportation or living halfway between places where people are working. So that's a really great added benefit. And, you know, we really work hard to make sure that residents have time off to get to go and explore the areas in the Bay. So we hope you check out our program. Feel free to check out our Instagram. Our residents have worked really hard in the last year to find, during COVID, to find a way to share a bit about who we are and the culture of our program. So I think that you will definitely find information there to help you see if our program might be the right fit for you, and wish you all the best in selecting the program that's the right fit for you.
All right, thank you guys so much. I'm gonna exit out real quick. Utah's slides were just added, so I need to refresh. So then they should just pop right up. Here we go. I saw them there, so once we load, we'll be ready to go.
We can start and you can just put it up when you get it. This
Perfect,
is
that
not
works.
a big deal.
Works for me.
For starters, I'm jealous of you guys getting to apply and experience and expose yourself to the number of awesome programs that exist in the West. And as many have said, the West is the best. And we share many of the same attributes of our program as with many others. We are a large, medium, or medium-large size program with approximately 90 residents between our categorical and combined programs. And yet the culture is truly family. And we like to tease that this is a Hotel California. Once people come here and are part of our culture, they never check out and never leave. In our program, we commit to getting you to where you want to be. And that is in a lot of different places and a lot of different specialties. Roughly half our residents go on to fellowship training. And in the last match, over the last 2 matches, 25 of the 26 residents who have gone on to fellowship training have gotten their first choice, which reflects well on our program. We are also a freestanding children's hospital that we've talked about geographic referral areas, and we have the privilege of having the largest geographic referral area of any children's hospital in the country, including the Continental, and then we serve Alaska Medicaid. Our residents come from all over, 33 states and 3 countries to our hospital, which has approximately 300 beds. We give you the opportunity to train in various settings. We have FQHCs, we have global opportunities, we have rural opportunities, and all those exist within the state of Utah. Well, with the exception of the global opportunities, which you do have to leave the state to experience. We are an X+Y program, and we implemented that last year and have had nothing but positive feedback on that. We talked about fellowship. We have approximately 14 fellowships, and of our residents that go on to fellowship, approximately half stay here and half stay elsewhere. Our diversity and inclusion efforts include a diversity elective, which is a funded elective, which we will put into, and it is in the chat right now. And we invite you to look at that. We really want to expand and increase our diversity. We have an anti-racism task force within our residents that has a seat at the table with our hospital and healthcare system. We have an associate program director for diversity and inclusion. We have a recurring series on microaggressions and biases and many of the other things that other programs have mentioned. We have an active wellness curriculum, and that starts with just living in Utah, which is a source of wellness for many of us. And also we have mandatory opt-out check-ins with our wellness support system, our psychologists that exist within our GME. And we have monthly wellness noon conferences that are just with our residents and allow them to have the opportunities to debrief and really share and really bond with each other. And I think that is, I would say, unique. You guys are going into pediatrics, which is by far the best specialty, and you've already swung the pendulum to the friendly collegial side. We would like to think that we take that to the next level. And I will, whatever, 2 minutes, in the last 2 minutes, let Jack and Dana, our 2 chief residents, give their perspective on our program.
All right. Well, again, just wanted to say thank you so much for taking the time to get to know all of us. We really look forward to meeting you guys throughout the application season. Yeah, Utah as a whole, I was just kind of blown away. Did not expect to end up out here, and now I'm having a hard time ever imagining having to leave. Hence the chief year, the remediation year. This has been a fantastic place to train for multitude of reasons, but one of the things that I really wanted to highlight that Bruce mentioned just is kind of the catchment area and the diversity of the patients that we're seeing, just given that we are looking at a map, kind of the main, one of the bigger hospitals in a multiple state area. So I'd say every single day on service, I have patients who are flown in from Montana, Wyoming, Nevada. It really is kind of a unique opportunity to not really know who you're going to be taking care of that day and where they're coming in from or flying in from. So that is one of the parts that I think just really, really has stood out in my mind.
We have an X+Y curriculum, which has been fantastic for resident wellness. If you haven't heard about it, instead of like a 4-week block, we do 3 weeks of inpatient or a mixture of like a 2-week elective and something else, and then 1 week of ambulatory experience where you do your continuity elective or your continuity clinics, and then any elective opportunities and research time that you would like, which is really moldable to like what you want to do in your career. So it's as someone who's going in to pick you, it left me time to work on some of those projects that I worked so hard on during residency, and gives you a little bit of a breather after being inpatient. And that has been glowingly positive reviews since we implemented that last year.
All right, awesome. Thank you guys. Thank you guys so much. I believe now we go to the Q&A part. So if you have any questions, you can put them in the chat box and I'll read them out and I'll just go in order. We have 25 minutes for questions, I believe. So just put them in the chat box and yeah, anyone has any questions. And I believe there's some on Twitter too, and those will get sent over to us. So first question we have, how do West Coast programs look at applicants that are from the East Coast? So any of the programs just want to give their 2 cents.
Well, the last shall be first, I guess. And we'll, our residents do come from 33 different states. And so we basically cover coast to coast. We go from New Hampshire to California, Washington to Florida. And so we welcome students from all over. I came out from the East Coast, southeastern in North Carolina. So.
I would echo Bruce. I think we draw from all over the country. I think it's helpful to look at program-specific websites as well. We do encourage people who are particularly interested in our program to just have a brief couple of sentences of interest, because sometimes it can be hard to tell, no matter where you're from, if you have a specific interest in a program or are just shotgunning to 50 different places. So if there's a place that you're particularly interested in, just make sure to look at that program's application.
All right, awesome. Does anyone else have anything they want to add?
Once you come to the West, you might not leave.
I would agree with the other programs. We look at all states and specific reasons for why you want to come to Loma Linda. We specifically